everyone. Welcome to week 1 of TMUC Survival Guide COVID-19 edition of our 5-week program. I'm Brianna Smith, and my team members are Uday, Nadia, Z, and Jordan. Everyone wave. Okay. Each week, we'll facilitate a session focused on COVID-19 topics that are relevant to the campus community. This program is hosted by TMUC public health students enrolled in the program implementation and evaluation class taught by Dr. Elizabeth Wachera in the Health and Human Performance Department. Today, we'll be highlighting information that you may already know about COVID-19 that is also important in laying the foundation for the next 5 weeks through the panel discussion with our guest speakers, whom I will let Uday introduce to y'all.
My name is Uday Okom, and I have the pleasure to introduce the experts among us. I have Emma Rebock. Emma Rebock graduated with a BSN and MS from Maryville University of St. Louis. She's an adult nurse practitioner with a background in primary care and acute care surgery in trauma. She's also a nursing practitioner here in the school. And also I have Ms. Judy Stackfield. She is the Vice President for Student Success and Dean of Studies here also in the school. Prior to this, she oversees the 12 departments and directly impact the lives of students and serve as a university executive team. She's also from Canada. I think I interest you. Thank you.
Okay, so to help kick things off with our panel discussion, we're going to get things started with the icebreaker. So I'm going to let the floor over to Nadia.
Thank you, Brianna. Hello, everyone. My name is Nadia, and today I will be administrating the icebreaker for our guest speaker, Ms. Amina and Ms. Judy. And also for the audience member, you guys will be able to answer the icebreaker in the chat. So my question for you guys today is, what is one thing that you miss about that COVID? And what is one thing that...
Nadia, do you mind repeating yourself? You were kind of cutting out a little.
Hello, can you guys hear me?
Yes, we can now. Do you mind repeating the icebreaker?
That you missed before COVID and that you can't wait to resume to.
Well, I don't know about Judy, but I definitely miss some football around here.
Yeah, I miss all things athletics, as there's no doubt. But I would also say for my icebreaker, I miss being able to go see my family. I haven't seen them since 2 Christmases now. So for me, going home for the holidays was always the time I got to see my family. So I haven't been able to cross the border to do that. So.
Well, for me, I can say that I missed the concerts and music festivals. Nadia.
And for me, I'll definitely say I missed the movies and meeting up with family. Thank you all again for answering our icebreaker.
Okay, so to start the panels, we're going to jump right into our discussion. And I'm going to start with you, Amina. So for question 1, Amina, not many people are fully aware of what COVID is. If you can inform us on what COVID is, how it spreads, and ultimately, who is at risk of getting COVID?
Sure. So COVID is a virus. It's a new virus. So we've had a couple of the coronaviruses. This is a different strain that causes the disease COVID. The disease itself can range from no symptoms at all, which is what about 45% of those who are affected by it have absolutely no symptoms. They don't know that they have it. However, they are still able to spread it to others, to severe symptoms where, you know, you have your lungs, you have pneumonia, you have severe respiratory failure and require a ventilator, this multi-organ failure, with prolonged hospitalization and a much higher death rate. Who's most at risk for it are going to be the elderly, so anyone over the age of 65, those that have obesity, particularly with a BMI over 40, are type 2 diabetics, sickle cell disease. There's no evidence right now, sickle cell trait, just the sickle cell disease are at higher risk, to heart disease, cardiomyopathy, heart failure. So it's going to be, our aunts and uncles, grandparents are going to be most at risk. However, right now we're seeing the trend that it's that younger generations, it's the 28 to 40-year-olds that have the highest rate of infection. On average, every person who's positive will spread it to 2 others. So if, one person spreads it to 2 people, those 2 people spread it to 4, then 8 and 16, and before we know it, it keeps spreading. Our students, the patients that I see, for the most part, they do fairly well. However, if you do spread it to others, how is your family member that may have diabetes? How would they fare? So that's why I think it's really important that we are doing all the right things that everyone keeps telling. It's the social distancing, it's the masks, it's the hand hygiene, avoid social gatherings. It's not that we don't want anybody to have a good college experience, we do. And we will have that one day. We're gonna weather the storm and we'll get through it, and we'll have the football games and the parties and the homecomings. But for right now, to, help mitigate this, help us, have some normalcy, help us be able to return to normal one day, this is just what we have to do, especially going now into the winter months where we already have the flu season that's just starting.
Thank you. I'm glad that you mentioned that the younger population is the ones who are most likely getting COVID. So Judy, being the Vice President for Student Success and Dean of Students, I know you're familiar with working with faculty and students. Do you believe that students are taking COVID seriously?
First of all, survival guide, that's kind of what this is about. And when I was thinking about students taking it seriously, I would say that it's not just students, it's everyone that has to take it seriously. And I think that we are just like everyone else. I think there are some that are taking it very serious. They're wearing their masks all the time. I see them walking on campus when they're even talking and walking with one another, they have them on. But there's always those that when they get comfortable and they think, oh, it's not happening to me right now, everything's good. As Amina said, sometimes they aren't showing any signs of anything, so they're not really feeling sick. They sort of get out of their comfort zone, right? And then they go to a party and they and come back, and then all of a sudden we have a problem. So I'm not sure if it's taking it serious. I think everybody understands that it's serious, but I think sometimes when we get on a college campus, we think we're all safe and everything doesn't happen to us when we're at college. And quite honestly, we need the students to take it a little bit more serious, and that and it stinks right now. It just stinks that you can't get into your regular routine. I said earlier, I miss my family home. I really miss the interaction with students. It's not the same if I can't see your smiling faces. But the fact of the matter is, we have to stay vigilant, and we have to do this. And it just isn't fun. And so I find when I walk on campus and I see people that have the mask below their nose, and I see them, just kind of hugged up to one another. I drive home every night by the housing units, and I see what's going on outside. And so if I had to say, do I think they're taking it serious? Probably not as serious as they should, because we do have to weather the storm. As Amina said, we will get through this, but we got to do it together, and we've got to be vigilant together.
Yes, I agree. I believe that, especially going into flu season and everything, students, continue to take it seriously. So with the weather changing and flu season approaching, Amina, How can someone distinguish flu symptoms from COVID symptoms?
So they have a lot of symptoms that mimic one another. You know, your sudden onset fever, headaches, nausea, vomiting, diarrhea, body aches, that's all going to be the same. So it is difficult to distinguish. Typically with the flu, you don't have shortness of breath. It's you know, a lot more rare than you do with COVID. You know, we've certainly seen a lot of that, the chest pains and the shortness of breath. And then a telltale sign of COVID is the loss of taste and smell. You know, we have plenty of testing available to students, faculty, and staff. If you know you have any questions, if you're not sure, come see us. That's what we're there for. In the office, we can do a rapid strep, we can do a rapid flu, we can do a COVID test. You know, we're there for you guys. Just let us know and come see us.
Thank you. Okay, so this semester we have transitioned to mandating face covering, social distancing, and enhancing sanitation in areas, as well as virtual events and virtual classes. So Ms. Judy, how has COVID-19 impacted our campus for faculty and students?
So in a big way it has, but I'm gonna correct because I think we say social distancing, and what I want to say is physical distancing, because we can still be social. I'm social with a lot of people, but I just physically distance from them, right? So I think if we kind of understand that we can still be social, we just have to do it in a very protective way. How's it impacted campus, faculty, staff, everybody? I think, you know, we want to provide programming. We want to get back to having norms on our campus where you guys can all mingle and we can have all these fun things that you're doing. We want to be watching athletics. We want to have sorority and fraternity events. We want to have all of that. And so I think where it's impacted us the greatest is that that no longer exists right now. We've had to go to more of a virtual format. And I believe that I believe we're learning from it. I've learned that I can actually communicate with some students now without even they don't have to make an appointment with me. We can do it virtually, where before I wasn't able to do that. But I think mentally, physically, your mental well-being, it gets a little crazy, right? Every now and then, because you're sitting, and I said to people all the time that when you guys, if it happens to you and you happen to go into quarantine or you go into isolation, and you live in the residence halls, let's say, you're in a residence hall you're in a room and it's a cubicle, you know. I have it, I go home and I have a bigger house to walk around. So the mental well-being, I think, is one of the things that has impacted. We've realized that that is probably our greatest need right now, is to take care of everyone. But it has opened up doors for us to realize that our counseling services can be done virtually. And you can still, we are probably more packed over there than we ever have been, because you don't have to physically walk up there anymore. But I do think it is, obviously you guys know, in the cafeteria and any of the eating establishments, it's a grab and go right now. We're trying to transition a little away from that, but right now that's what we had to do. And so I think it impacts because we're not just hanging around sitting talking anymore, and that makes it very difficult. Faculty, I think people like to be in the classroom. I don't know about the people around this lovely virtual event, but I think people like to hang out and walk. And I come in the morning and there's no one in the halls anymore, and so it does impact us. It's a lonely place, but we're trying very hard to get everybody to jump on to some things virtually. We have limited how many people can be in rooms, and there's a capacity there, but we still can have events, right? We can have some people online and some people virtually, and some people face to face. But the impact is great, and I think it has impacted us where students have gone home, so they're not here, and that's not fun. And I think we've also we have a lot of freshmen that chose not to come to campus at a lot of campuses, not just ours, kind of waiting it out to wait to see if there's a vaccine that will will help everybody feel a little bit more safe when they get to campus. So that's the other areas I think it's impacted us, is just the number of students being back on our campus.
Okay, well, thank you. For students who don't know where the counseling center is, Ms. Judy, where is the counseling center?
Yeah, so the counseling center is in the Holiday Building, which I always tell people, you know where the ATM machine is over by the field house, then the Holiday Building is right there. But you can always just go to the Dean of Students website, the counseling center's there, click on it. You can actually set up some virtual events and all of that. So they do take that. That's how they're doing most of their screenings with people now.
Okay, well, thank you.
Yep.
And for our audience, if you have any questions during our discussion, please drop them in the chat. We're going to have a short question and answer after this. Amina, you say that COVID symptoms include coughing, dry cough, and fatigue. If a student has those symptoms or believe they have been exposed to COVID-19, where can they get tested on campus?
Sure. So the most important thing is, if you have had an exposure or if you're having symptoms, is to isolate yourself, right? So quarantine, stay away from others. If you have a roommate, try and stick to your space, preferably your own restroom or main area. You can sign up online in the Healthy Alliance website, so tmuc.com/coronavirus. There's 2 steps. One step is you sign the consent if you haven't already, and step 2, you sign up for the test. It's a drive up, so you drive up to us, we do the test, and you leave. Certainly if you're walking on campus, you can walk up as well. The test it's not a nasal, it's an oral, so it's just a couple of swabs in the mouth. You perform it yourself. We essentially just prompt you and watch you do it. The tests are done in the morning, in the afternoon. Certainly if there ever comes a time where you feel like you need to be seen or there aren't any slots there available, please reach out to us. We'll work you in, we will get you in. We test Monday through Friday, unfortunately not on the weekends at this time. Turnaround time is 24 to 72 hours. Typically it's been 24 to 36 hours, the turnaround time for them. It's a PCR test, so it's viruses don't have DNA, they have RNA, but it's essentially like a DNA test for the viruses. So it's really sensitive and really specific, much better than the antigen tests that are available. So it's a really good test. It's fairly accurate. Again, you can sign up on the TMUC/coronavirus website. You can always give us a call to Student Health as well. It is also available to faculty, staff, students at no cost.
Okay, thank you so much. For students who also don't know where the Student Health Center is, do you want to let them know?
Yes, we're right by UPD. So we're on the first floor of UPD.
Thank you. So Ms. Judy, we can all agree that there has been many challenges. What are some challenges adapting to this new norm?
I would say and I saw one of the questions on how, I'm coping, and it was saying how Amina's coping. I think some of the challenges are trying to figure out ways to cope. I think the challenges right now are to keep people engaged. I had them actually sitting here because I look at them, even when students are in isolation and quarantine now, the challenge of trying to keep them engaged as well, and making sure that they understand why we're doing what we're doing. But the counseling center, and I'm just holding these up, but the counseling center has like these 14 cards for things you can do every single day that you're in quarantine or you're in isolation. And I think we're trying to find ways to keep you engaged, keep you safe, and make it seem like I think people are thinking it's a punishment, and it's not. It's just, I think the challenge is that engagement piece. So every unit that I work with, and quite honestly, Student Health Services, they are working well overtime, just trying to do everything to help you guys. But so is everybody else in our division too. And I think from our caseworkers to the challenge of when we have people in quarantine, to be able to feed them and get all the food there to them, and the challenge of making sure we have enough isolation rooms for everybody. or quarantine rooms for everybody. So we are working on a lot of that with our EOC, that operations center, the Emergency Operations Center. And we work with them to really give us indication on what we should be doing. So it's really getting everybody on the same page, getting information out. And I would say on the student end, the challenge is for us is to just really take it serious and understand why we're doing what we're doing. You know, I had someone ask me about throwing parties today. And our challenge is how can we still have that same fun without actually going to a party where you potentially would be doing some dangerous things, right? If once we start drinking, the masks are coming down and all of those things are gonna happen. So I think that's been a challenge. The other challenge is that not understanding just really the rules and to make people aware that the rules are there to really help. So trying to make sure that people don't go into our residence halls from other halls and cross-contaminate and do things like that in living spaces. I don't let everybody come into my room at my house, so why would we let everybody come into your room in your house? And that's a challenge, and that's a huge challenge because I don't think students understand why we put those rules in play. And we're trying to make sure they understand, but everybody wants it to be normal, and it's just not right now. So there's a lot of challenges, but I think those are the key ones for me.
Thank you. I feel like it'll be a while until we can adapt to the new norm. So our audience has some follow-up questions, and I'll invite Z to drive the question and answering session.
Hello, my name is Z. Today I'll be over question and answers. So, Ms. Judy, what would you recommend for students and organizations to help them understand the gravity of COVID and its impact?
Where is that question? Say that again for me a little slower.
What would you recommend for students or organizations to help them understand the gravity of COVID and its impact?
Okay, so one of the things I would say is invite people like Amina, like the folks from our students, our health center, to come in and really give them that educational piece, right? I get educated all the time. I either call Amina, Max, all the folks that work in there and ask some questions. We have epidemiologists that we call to find out if we're doing the right thing. Should we be changing the way we're doing it? So for students and student organizations, taking that leadership approach to say, invite us into a Zoom, I'd be happy to go into any of those. And I have. I talk to student government quite a bit, but bringing us into those so that we can have those one-on-one discussions, that if people are having trouble understanding, that we can really break it down for them. And certainly I know it's all on the website, and I've been in academics advising long enough that I know students don't always read, but it is all there. And if you just read it, you'll see the gravity of it. But I think there's nothing more important than talking to someone face to face, right? And even if it's around a virtual room, we can have those discussions, and truth can be talked about, right? And worry can be talked about, and how we can help you with the anxiety of it all. So that's what I would recommend. Mm-hmm.
Okay, and this is for both of you guys. How do you both personally adapt to COVID?
You just do what you do. I started here the week that everything, shut down. I was lucky enough to be able to stay home for about a year with my kiddos, and I started March 10th, I think, when everything shut down. So for me, it was from the get-go. It was, you're at work every day, every day it's something unknown, something new, but you just got to stay positive. You know that we're going to get through this. We're all going to get through this one day. We just have to get through these growing pains and, wear our mask. And as Judy said, physically distance, and we'll get through it. And I'm just looking, at the end of the tunnel.
Yeah, and for me, I hate it. I just hate it. But I will tell you what I've learned. I've learned that even though I've had FaceTime for years, I've now learned that I can actually FaceTime my friends. And so every Sunday I have a FaceTime party with my friends, and we sit, we cook, we do all kinds of different things, and I do it with my family as well. So it's brought me actually closer than I thought, why haven't I done this for years? But it took COVID to come in for me to realize, man, this needs to be a priority in my life now, to really reconnect and connect with my loved ones and my friends that are all over the country and the world. So I've found ways to survive just by doing that.
Okay. And this one's for Ms. Amina. Do you believe the university should mandate every student to have COVID-19 testing?
No, and not everyone should. And are you having symptoms? Were you an exposure? At the end of the day, we as healthcare providers, we can't make anybody do anything. We can guide you, we can make recommendations, but I think it's a personal choice at the end of the day. But most of our students, I should say all of our students, have been very responsible, and they're always calling us or emailing, well, I was with so-and-so and, so-and-so's tested positive, am I at risk? So that really hasn't been the issue. We've had, a lot of students reach out and, they want to know, hey, am I at risk and should I get tested? So no, personally, I don't think it should be mandated. I think it's wonderful that the university, we have the capabilities to do it, and, that there's no charge for it. Obviously, that's a big burden for a lot of our students. So it's there if you feel like you need it, or if you have questions, whether you should get tested or not. As far as quarantine goes, again, if you have been exposed to someone and you've been asked to quarantine, it's so important. We're seeing infections on day 8, 9, 10, 11. So just because you've had a negative test or you don't have any symptoms, you have all the way up to 14 days to develop the virus, which has an incubation of anywhere 2 to 14 days. So, I really ask you guys, if we're going to get through this, is do your 14 days in quarantine. I know it's a lot of days. It stinks. You're by yourself, but you'll get through it. And then, for those who have to isolate, again, it's the 10 days from the onset of symptoms. It's 10 days from your test, and we just got to get you through it, get you a negative test, and get you back on campus.
Okay. And for Ms. Judy, if there is a peak of COVID cases after Christmas break, will classes be solely online?
I think we've been a university that's learned to pivot pretty quickly whenever anything happens. I think the plan right now is that when we get to the Thanksgiving break, that we are, most of our instructors are moving all of their stuff onto an online platform, right? So we're not going to be closed. We never will close, because we know there's a lot of students that really need to live in housing, and that's where we'll have it open for them. But I think after the holiday break, when we all leave and come back, I would just say that I don't think we have to see sort of where the numbers are, and then we'll figure it out from there. And once again, our university will pivot and pivot well. But I would ask that if you're going home for the holidays, you still have to maintain. I know it's going to be family time, but you have to stay the course and really be thinking that when you come back, are you bringing this back to us? I wear my mask, it's not for me. I wear it to protect you. So that's kind of what I think all the time. Let's protect each other, our families. And so, yeah, I think we'll pivot if we have to, but right now there's no plans in doing that.
Okay. And for Ms. Amina, someone says, I have friends recovering from COVID-19 and they have been told they are safe from contracting it again for 3 months. Is this true?
It's a great question. So yes and no. So the first 3 months after your infection, we don't really know the immunity status, but we do know that you're at a much, much lower risk of contracting it again. So according to the CDC, if you recover from an infection for the first 3 months, unless you're having symptoms, you do not need to get retested. If you have had an exposure during that time, you also don't need to quarantine again, unless you develop symptoms.
Okay. For both of you guys, with the virus being asymptomatic at times, should we get tested even if we feel okay?
I'm going to let Amina answer that one.
So no, we want to, reserve those. Yeah. So if you're just getting tested to get tested right now, we're doing some surveillance testing on the athletes, on our high risk, like the UPD, the student health services. So unless you've had, a direct exposure or you're having symptoms, we ask you not to get tested at this time.
Okay. And for Ms. Judy, do you believe the choice to end school on Thanksgiving break will better the circumstances of COVID coming back from the break?
I think it's our concern is not just the fact that we have COVID, but there's the flu. All of that is coming. It's we want to get flu shots now. I mean, that's what we need to be doing. So I think one thing we do is we think really hard how we're going to do things. And we get with all the system schools, we figure out what everybody is really thinking on each of our campuses. And I think it's the right move. I think it's, again, we're not closed, right? So if you are still here and wanting to live in the residence halls, they're open. It's just that Thanksgiving break when we know a lot of families are together, and Thanksgiving seems to be even bigger than any other holiday in the United States, at least I feel. It's a big family gathering, right? And so I do believe that just going home, and let's face it, guys, it's only 10 days coming back. I always used to say that, man, they make you come back for 10 days and then you're back home again. So I think that's why, it makes no sense to just why not just stay home? That's kind of what we're thinking. And that's the sort of the genesis in it. It's only 10 days.
Okay, so we're gonna take one more question.
Okay, so for both of you guys, how do you feel about some businesses not enforcing the mask policy in certain stores and restaurants?
Well, I will let Amina talk about that on her perspective. On my perspective, it drives me nuts. It really does drive me nuts. I take it pretty seriously, and I don't want to get COVID. I want to stay far away from it as I possibly can. So when I go into restaurants, I'm very careful. I don't eat out that much anymore, really. But if I do, I'm very careful. I like to eat in the outdoors. I don't actually want to be in the indoors. So but it drives me more nuts when I go into a mall. If I have to go to Walmart and I see people not taking it seriously, I just avoid them. I mean, I walk around them and do all of that, but yeah, it drives me crazy. And that's me as a non-medical person. So Amina will give you the medical side of the house too.
Well, everybody has their rights. That's the beauty of, America. But I really believe that we should all do the best that we can to help protect one another. We know that masks work. We know that social distancing works. There's a study that came out that masks filter about 96% of the virus particles. Whether that's going to be substantiated, that's to be determined, but that's some of the data that's coming out. We know it works. So for them not to make it, it's a little irresponsible. But again, these are the times where we're just kind of polarized. It's yes, mask up. I believe in the mask. Oh, I think all of this is a hoax, and I don't want to wear a mask. And let me tell you, it's not a hoax. The website has a lot of information on just the university. It's got a dashboard on how many cases we have, how many recovered. Same with regionally and nationally. I mean, we're over 200,000 deaths. That's astonishing. That's just it's here, it's real. Let's do our part to help mitigate it.
Thank you, guys.
And Z, can I say one more question? I know there was one in there, and I think it's a really important one. Someone asked where you can get all this information. And if you just go to the main website, it's the Stay Healthy Lions site. It has everything in there that you want to know. And if you haven't done your CARES Act money, also put that in there too, because it's all on there. It's a big red. You can't miss it if you go to our website. It's right at the top in big red. So hit that, read up on it, and you'll get all the facts.
Thank you so much for the information.
Thank y'all for answering these questions. So to wrap up our discussion, what is one thing that y'all both would hope to get, what is one thing you would hope the audience and campus get from this session? I'm gonna start with you, Amina.
Sure. I just hope you guys know, we care about you all. We want what's the best for you. We're not making these arbitrary things up. We know that, masks work, physical distancing works. We're all going to get through this. We're here for you. If you guys ever need anything, any testing, if you need to be seen, reach out to me at any time.
Yeah, and I would say the same. We just care, and we make rules to keep you guys safe. And so if anything, I just want everybody to know that our doors are open. We're a Zoom away. We are a FaceTime away, and you can always walk into our offices as well. We have masks on. We have those available. And not only that, we have sanitizer as well that you can wash your hands, do all of that. So we do care, and we want the norm to come back, and it will, but we need everybody to chip in on this.
Well, thank you both. This has been a great session. The goal of the session and the entire program is to facilitate COVID conversations that answer questions that the campus may have to help keep our campus COVID-free. We want to give thanks and appreciation to both our guest speakers for taking the time to share with us and talk with us. Our viewers, let us know what you think and spread the word about our program and the entire group of week one. I want to say thank you as well.
Thank you.
Thank
Thank
you.
you.
Thank you.
Thank you.
To everyone watching,
You guys so much.
I also want to say thank you for tuning in for the virtual COVID awareness program. Please help us keep this conversation going and our campus informed and connected with us on social media, where we'll be posting the session and topics. Tune in next week and we'll talk about how we can keep our campus free from wearing masks, social distancing, and what masks really work.